Placenta previa is a significant obstetric complication characterized by the abnormal insertion of the placenta in the uterus, partially or completely covering the cervix. This condition poses considerable risks during pregnancy, labor, and delivery, necessitating careful monitoring and appropriate medical management. The precise etiology of placenta previa remains elusive, but certain risk factors are associated with its occurrence. Maternal age is a critical factor, with advanced age increasing the likelihood of placental abnormalities. Women who have had previous cesarean sections or uterine surgeries are at an elevated risk, as are those with conditions such as endometriosis. Multiple pregnancies, such as twins or triplets, also increase the chances of placenta previa. The hallmark symptom of placenta previa is painless, bright red vaginal bleeding. This bleeding typically occurs in the second or third trimester of pregnancy and is often spontaneous. The bleeding can range from mild to severe and may be intermittent. While bleeding is the primary indicator, some women may also experience abdominal or pelvic pain. However, pain is less common and may only occur in cases of significant bleeding. Placenta previa is also associated with an increased risk of preterm labor and delivery. Prompt and accurate diagnosis of placenta previa is crucial for appropriate management. Two primary methods are employed in diagnosing this condition. Transvaginal ultrasound is the gold standard for diagnosing placenta previa. This imaging technique provides detailed visualization of the placenta's location in relation to the cervix, enabling healthcare providers to assess the extent of the condition accurately. A pelvic examination may be performed to evaluate the cervix and identify signs of bleeding. However, this method alone is not sufficient for a conclusive diagnosis and is often complemented by ultrasound. Once diagnosed, the management of placenta previa involves a combination of careful monitoring, lifestyle modifications, and medical interventions. The specific management plan depends on the severity of the condition and the gestational age of the fetus. Women diagnosed with placenta previa are typically advised to refrain from activities that could trigger bleeding, such as heavy lifting or sexual intercourse. Bed rest may be recommended, especially in cases of moderate to severe placenta previa. Severe cases may require hospitalization to closely monitor both the mother and the baby. Continuous monitoring allows healthcare providers to respond promptly to any signs of bleeding or other complications. In cases where there is significant bleeding, blood transfusions may be necessary to replace the lost blood volume. Close monitoring of blood counts and coagulation parameters is essential to identify and address any potential complications. The majority of pregnancies with placenta previa result in a scheduled cesarean section. This approach minimizes the risk of bleeding during vaginal delivery, providing a safer option for both the mother and the baby. In conclusion, placenta previa is a serious pregnancy complication that demands vigilant prenatal care and medical intervention. Timely diagnosis through ultrasound imaging, coupled with a comprehensive management plan, is crucial for ensuring a positive outcome for both the mother and the baby. As our understanding of this condition evolves, ongoing research and advancements in medical technology will likely contribute to improved diagnostic accuracy and refined management strategies. Pregnant women with risk factors should prioritize regular prenatal care to detect and address potential complications early in the pregnancy, optimizing the chances of a healthy delivery.